Hello, psychology students. This is Mrs. Politsky, and I have your notes for Module 14, Prenatal and Childhood Development, and we're going to talk about infancy. So, when we talk about that movement from being born into childhood, some things that we should kind of keep in mind. We had talked a little bit about teratogens and certain abnormalities that can happen during the prenatal stage, but there's a few other little things that I do want to mention. And the images that I'm showing you right now is an example of what we call a cleft lip and sometimes a cleft palate. The thing about cleft lips and cleft palates, these are not related to anything that is like substance. And so in a sense where if a mother is taking medications or drinking, has nothing to do with the child developing this. This is more of a genetic kind of situation. But the wonderful thing about modern technology is that children who are born with cleft palates and cleft lips do have wonderful medical resources that are available to them. For the most part, an infant may have to wait until they're roughly 6, maybe weeks old before the cleft lip can be surgically brought together. When we talk about cleft palates, depending upon the extensiveness of that palate, which would be the upper palate of your mouth. If you take your tongue and touch the roof of your mouth, that's the upper palate. There may be some cosmetic things that can be done. You can put in kind of a piece of basically what probably would equate to like plastic or such to help provide a barrier there between the nasal cavity and the mouth. Over time, there's ways that you can kind of get the palate to close on its own, but it usually takes a little bit of time and most likely several surgeries to make that happen. We mentioned before in our first set of notes about fetal alcohol syndrome. And what I have here are 3 images of 3 individuals that have fetal alcohol syndrome. And some of the things that you might see, because this is one of those birth defects that is probably a little more identifiable by the look. Typically, children who have fetal alcohol syndrome have wide set eyes. Typically, the bridge of the nose is a little bit flatter. When we talk about the space between the nose and the lips, typically there is like a wonderful little dimple there that most people have. Children who have fetal alcohol syndrome, that area is typically very flat. So in a way, sometimes you can see this visually. Doctors have a tendency to be able to see this in certain patients that they are dealing with. So needless to say, that is one of those birth defects that it's a little easier to see as far as the diagnosis. So let's talk about our newborns. Within our first half an hour of birth, infants will have the ability to turn their heads to watch a picture or a drawing of a human face. They will not turn their heads to view undistinguishable jumbled images. What this basically tells us is that our small infants maybe have an innate ability to look for a face. And for the most part, staring very closely at their mother or their father actually brings them great pleasure. Newborns also turn their heads towards human voices. They have definite taste preferences. Typically, sugar, water, and mother's milk is something that maybe our young infants probably prefer. Mothers who are nursing are usually told kind of what they should eat and what they shouldn't eat. Foods such as like broccoli, or maybe very, very spicy foods are not really recommended. Part of that being the fact that it does mess with the taste mechanisms for our infants. Along with that, our infants have certain reflexes. Newborns don't learn to suck, swallow, grasp. This is something that is innate. It's automatic. It's unlearned. So, for example, if father or mother would take their index fingers and have their infants grab their fingers, they could probably pull them upwards because our infants have a certain grasping reflex that makes them hold on, and for the most part, you can pull them. Wouldn't necessarily recommend it, but it is something that infants have. Along with that, the rooting reflex, which is that tendency that if you brush the cheek of an infant, their mouth will typically open and they're searching for like the nipple of a bottle so that they can nurse. Along with that, we have the temperament. The temperament's kind of like your personality, but a person's characteristics, their emotional excitability, this is very noticeable within the first hour after birth. Not to say that a colicky baby is going to be a difficult person as they grow up, but there are some babies that have a tendency to be a little bit more relaxed, perhaps maybe a little type B. So, needless to say, we will see those things early on. When we talk about physical development in infancy and childhood, usually the first year of a child's life is known as infancy, meaning that they are an infant. Once we pass that first birthday up till about the third birthday, we have a period of time known as toddlerhood or being a toddler. And then from 3 years onwards up to the beginning of adolescence, we usually call this childhood. So let's talk about our developing brain. During prenatal development, your body is made of lots of nerves that are developing at a rate of roughly 4,000 per second, though some researchers are suggesting that that number might be higher. But in part, these neural networks will continue developing even in adolescence. They were a result of maturation and our development. We had talked a little bit back when we were discussing the brain and the nervous system about the neuron. And at birth, we are rapidly developing neurons. During that infancy period of time, these neurons are making connections, meaning that we are learning lots about our environment. By the time we get to about 15 months, our neurons have really established very definite networks. At some point in time, there will be a pruning back stage. And again, this will happen once more when we hit adolescence. So, maturation, this is the biological process that enables orderly changes in behavior. So, for example, as we're developing, we typically roll over, and usually that happens within maybe the first 3, maybe 4 months. Then we eventually get into kind of a crawling, if not maybe a creeping stage first, and then eventually crawling. And then from there, we might learn to pull ourselves up and eventually start learning to walk. And then once we've established walking, we can speed up the pace and start going towards running. This is based largely on our genetic blueprint. We don't just start running. And if you compare maybe human infants to, other mammals, typically horses, giraffes, animals like that are walking within moments of of their birth. For us, it takes a little bit of time, and that's part of that maturation. Experiences do affect certain development. Parents who talk and in some cases even read to their children foster neural connections that may help with developing reading skills as time goes on. A lot of pediatricians will even recommend just, if a parent is reading a book, just read your book to the infant, even if it's something that they're maybe not interested in. But, just the whole idea of having a conversation, even kind of that might not necessarily seem to be appealing to an infant, can actually be very beneficial in making those neural connections. For the most part, we can't remember much before the age of 3. We remember little of what happens in our life before really even ages 3 to 5, because we don't have those neural connections in our brains that allow us to have those cognitive memories. As far as motor development is the development of our muscles. Physical skills and muscular coordination are products of the developing brain. The neural pathways and muscles necessary for things like crawling mature before the pathways and the muscles for walking. So we all walk typically before we run, because developmentally we're ready to walk before we're ready to run. Normally in this country, roughly 25% of babies will walk probably by the time they hit about the 11th month, so right before their first birthday. Within a week of the first birthday, usually about 50% of all infants are walking, and those who are not, almost all will be walking a short time thereafter. And part of that is because the brain is developing those networks. Thank you very much.